So IAF is rolling on. We have a tremendous show for the rest of your day. Kicking us off before our stretch here from break to lunch is a panel on a very important topic. You've heard so many leaders already talking about mental health. Leading us in this conversation is Matt Banker, who is founder of MB Sports Consulting and co-founder of MB Sports Consulting and senior advisor to CCH+A Sports Law Group. Gentlemen, take it away.
Great. Thank you, Eileen. Good morning, everyone. And as Eileen hit on, this is a super important topic, so very grateful that the SBJIAF included this session today. One thing the past couple of days we have heard mental health be referenced in other sessions, including Gordon Gee yesterday saying the number one thing he's hearing from students on campus is loneliness. And so the timeliness of talking about this in the context of college athletics is a really good one. I want to introduce our panelists today, first starting Walt Norley, who is founder and CEO of OnBalance. And to my right, Dan Radakovich, Vice President and Director of Athletics at the University of Miami. Today's session entitled Addressing Mental Health, the partnership between OnBalance and the University of Miami. And Walt, I want to start with you in particular because your story, I think it's helpful for the audience to hear a little bit about your college athletics journey and how that's even influenced your role with OnBalance.
Yeah, so this is my sixth company in technology that I've built, and really the drive. This has a different purpose for me than some of my other businesses. I'm a former student athlete at both Ohio State and Georgia, played quarterback. Got diagnosed with bipolar when I was 25. Fought that diagnosis for a long time, the stigma associated with it. Obviously a time where people just didn't talk about that. And so I had a hard time accepting the diagnosis. And because of that, I went through a pretty volatile journey. I was very fortunate to be able to do what I did professionally, but it didn't come with some pain. And then I think thirdly, my whole background has been in taking data and its performance management, trying to figure out what you do with the data to create insights to improve outcomes. And the combination of my own journey as well as former student athlete, I have children that were student athletes. I think it's a great cause, and I think we have the ability to make a big difference.
And thank you for sharing that context, too, about your mental health journey. And I want to ask actually both of you, and Dan, I'll start with you on something. And Walt, you referenced the term, the sort of stigma around even seeking mental health care. And from an athletic director's perspective, how Miami's sort of strategized around that to support your athletes, including to feel more comfortable coming forward.
Well, I think like a lot of schools of Miami size, we have a lot of opportunities for our student athletes to grow, whether it's in sports medicine, nutrition, academics. We put a lot of services together for them. We want to make sure that our mental health services are right at the top, but we also understand that student athletes, they still want to, they want to feel protected as they go through their journey where they may have some mental health issues. So one of the things that we ended up doing, we have a medical center that is very, very close to our hub on campus of athletics, is we put our mental health professionals over there. So our student athletes could be going over to the Lennar Center, which is the medical center, for a sprained ankle. It could be going for a flu shot. It could be going for 100 different reasons. But they also could be going over there to talk to our counselors. And we have 2 full-time counselors, and we also utilize services through the University UHealth, University of Miami Health clinics that are downtown in Miami. So we wanted to make sure that we had a lot of things covered from a mental health perspective. But then when I met Walt, we looked at how do we take this data and then maybe have the ability to get somewhat predictive, understanding where our student athletes are, what kind of things, do we have a high level of a certain diagnosis? Well, do we have the right professionals to be able to help them through those problems? So we entered into this arrangement with Walt, and we're really enjoying moving along the journey. We have a long way to go yet, but I think that the idea of utilizing this data to help set the baseline for what kind of services you give to your student athletes, I think is going to be an important one.
Anything you wanted to add to that, Walt?
No, look, I mean, from the perspective of working with Miami, Dan and I met through a mutual relationship with Nick Saban and came on. We have a podcast called Athletes on Balance. It's not a marketing tool for the firm. It's about awareness with progressive athletic directors, progressive coaches like a Nick Saban, mental health experts, and athletes talking about it, because we're firm believers that the more people understand that it's okay to get treatment for their mental health, just like their shoulder or body, the quicker they're going to recover. So Dan and I met through that, and I could just tell from the interaction that this is something that was important to him from a strategic standpoint. Has a businessman's type perspective. This is my first foray into the university world, so I'm used to the private sector, public sector company world. And I could just see that there was a person here that understood, our kind of mantra. Peter Drucker, the famous consultant, you can't manage what you can't measure. And I saw that in Dan, and that created the relationship.
One thing that's been in college athletics and the ecosystem for a lot longer run is data analytics around sport performance. And it's something we've got obviously more information that's fed into the coaches and treatment to an extent, but is there a correlation there with the data that can be collected around mental health and like you said, improving outcomes? So starting with you, Walt.
Yeah, I think as I've gotten exposed to this collegiate sports science world, I think there's, first of all, Dan and I were talking about it, this falls right under the umbrella, right? It's part of sports medicine, sports science. You look at, kind of the foundational times of when they started tracking data for strength and speed and rest time and, essentially performance optimization 15, 16 years ago, roughly. I think the mental health side of this is nascent, and it's where it is today. But data getting collected and trying to make sense of how you take care of the cases with more insight and more intelligence, just like athletic performance, I think there's a great correlation.
I think one of the other big pieces is the anonymous nature of the data. Okay, that's also really urgent. When we first started to talk about this with our mental health professionals, that was the first question that came to their mind, is along with our sport administrators, is we really can't gather this data and have names and things associated with it. That would be a real problem. But this is anonymous data to give us trends so that we can understand where we need to best put our resources. And we thought that what Walt and his staff had pulled together from that perspective really was groundbreaking. And I think that that's really going to assist us moving forward. But we had to get by the idea that this is not going to be something where a student athlete would find out that all their mental health issues are going to be given to outside the University of Miami family. This is really data to help us treat them better.
Dan, I want to stick with you because obviously as your role as the athletic director, revenue generation, which has been a topic all over the place the last 2 days here at the conference and certainly seeping through college sports, but part of your role too is allocation of resources. You referenced it a little bit there, but can you walk us through from an AD's perspective how you go about calibrating where those needs are, who you're relying on campus?
I think that from how we looked at this is another tool in our toolbox to help make our student athletes better. What kind of data can we get from this so that we can take those finite resources and put them in the best place to help our student athletes? Sure, we have a couple of mental health professionals, but do we have the right ones? Do we have to go and create a consulting circumstance with a different kind of group so that we can take care of this one issue if the two people that we have are not, that's not their specialty? So without that data and without that knowledge, and not anecdotal knowledge, okay, I think we all deal in a lot of anecdotes that come forward. We need to have the real data to be able to say, okay, if we're going to make this other investment, we need to feel good about the data that we have to be able to move forward. Because, as was stated, the resources, whether you're looking at sports medicine or sports science or strength and conditioning or nutrition or tutors or academic help, these are all under the umbrella of making the student athlete's experience better. So how are we going to move those resources around.
Walt, I want to kind of pivot off of Dan's comments there because you're also having a lot of conversations with many other schools, maybe even some in this room, and there are college athletics administrators from various campuses here as well. Can you kind of speak to even observations as someone who's not in college athletics day to day, so to speak, what you're seeing in terms of the support and structure and how OnBalance can fit in?
Well, I think a couple things. One, yeah, we are getting exposed on a national basis, D1, D2, D3. Just brought in a head of sales that was from Catapult, talking about the sports side of it. But two things. One, in terms of market demand and where things are trending, the numbers for how many active cases within a university, clinical, non-clinical, at any given period of time are between 20 and 50%. So not trivial numbers, 600, 450 student athletes, those are real numbers. The numbers aren't going down for a lot of reasons. One is obviously all the NIL pressures, transfers seem to go through, from the standpoint of cases, a high level, probably not surprisingly. And on the flip side of that, because some of the programs like Miami and others are progressive and trying to destigmatize to get holistic care. Holistic care is something I hear all the time. And that again falls under sports medicine. Without breaching data privacy on the mental health side, how does that sport med crowd, athletic trainers, sometimes coaches, how do they collaborate to take care of their, the athlete within any sport? So, because of that, there's one university in particular where they're actually proud that the fact that their number's so high, which is towards 50%, because they've created an environment when it's okay and it's open to come get treatment like it would be for a physical injury, the same. So there's an openness which drives up the number. So I see the demand go up from a pure kind of market perspective, and because of that and the awareness, the resource allocation is probably, and Dan can speak to that, it's something that within this new world order that I guess the question I have is, a tech guy, what will happen from a management standpoint when mental health is not going this way or flatline and it's increasing? Does that have an effect on budgets with the changes that are happening with this lawsuit settlement?
Oh, I would think for sure it would, and we talked about it just a second ago. You have all of those different disciplines under the student athlete welfare umbrella, and it may be in certain years based on the data that you're getting. Okay, I can put a little bit more of my resources maybe into mental health because number one, I see a need. Number two, I feel comfortable with the data, and number three, it's something that's very important to my student athletes. Okay. Those are things that we talk about, and that's going to be part of our exercise moving forward. But Walt's right. It's not just athletic departments that have the need for this type of data. The university in general, the infirmary or wherever on campus, the general student population gets their mental health help. They would be served very well by having this data also to be able to know how they would be able to spread their resources throughout a campus. So it's starting here in athletics, but I think it has movement opportunities throughout the entire university.
Dan, I want to stick with you and a question for both of you. There's obviously been reference to NIL, the changing landscape of what a student athlete experience looks like, and some of those embedded pressures, including financial, legal, other considerations that student athletes, young individuals, young adults are facing. Can you kind of speak to what you're seeing kind of from an athletic director's perspective about that landscape looks a lot different than it did even 5-10 years ago?
Well, there's no doubt, and I know for my colleagues who are athletic directors out in the audience here, we have done an awful lot of education, or at least attempted to do an awful lot of education for financial literacy, making sure our student athletes understand, how to do those things with their newfound resources that they're getting, whether it's in traditional NIL now or soon to be part of a rev share. But I think we all understand that sometimes student athletes, you can put the programs out there, but they don't always take advantage of them. And that's something that's just inherent in college students in general. So we do have to have that backstop. We do have to have that mental health piece, there and waiting, because it's almost the last resort, as they get put in under a lot of pressure, whether it's through their families, whether it's through their relationships, whether it's through a realization of, I got to pay my taxes. How am I going to get there from where I am right now? So a lot of us have put resources in, but we have to continue to do that because the opportunities for student athlete issues are going to continue. NIL and those other opportunities are going to continue to make that happen.
Walt, anything to add there, just in terms of the new sort of domain of pressures that are around student athletes days? Dan referenced a few, but also sports wagering, online, harassment from fans. There's a lot there that student athletes are dealing with these days.
Well, I think it's another reason why the numbers are trending upwards. I mean, each year it seems like the pressures on 17 to 22-year-olds keeps increasing. But I think the problem, the people in the world that we live, they call it a crisis. And I've gotten to know Dr. Brian Hanline, who just stepped down as the chief medical officer for the NCAA. And Brian was responsible for bringing mental health into the foray within this world, both in 2013 when he first came in, and then he just put his last guidelines out last summer. But you have young people that at the high levels that are exposed to money that is, as we've spoken, that is just kind of to some degree unfathomable, right, for people at that age bracket and have no experience. But secondly, the social media. I mean, I hear the number one thing I say, well, why is there a crisis to Dr. Hanline? Everybody just pulls up their phone. I mean, it's almost as simple as that the phone and social media and the bullying. And I really wasn't aware because, again, I don't live in Dan's world, but I really didn't understand the legalized gambling that has happened. And therefore, you've got an organized way of social media bullying.
Good segue to a question we do have from an audience member, and I'll toss this out to both of you. And the question is there a concern that NIL deals and the pressure to be, quote, on in social media and other media outlets will translate to the need for more mental resources? So something that you're both kind of touched on a little bit, but anything there that you want to react to?
I'll give that to Dan. He runs the budgets.
Well, I think that for sure, I mean, just understanding what Walt just talked about with the gambling and all of those other pressures, yeah, the student athlete's world is not going to get easier. I mean, it really just, you're injecting money into the system. You're injecting money into people's pockets. It doesn't take a high-level therapist to figure out that when you have more money, you have more problems, as a famous rapper once said. So I think that's where we are with our student athletes. We have to be there as stewards to help them through this. And again, the utilization of software and data mining of resources and data points that Walt's OnBalance company has been and it will be a real help for us.
Walt, I wanted to ask you too about a little bit under the hood about the platform itself, but in particular, and Dan mentioned data mining, but artificial intelligence is obviously ubiquitous these days in the news, and it's certainly hitting higher education and college athletics is probably coming down the pike here. But does OnBalance utilize AI in any way?
Yeah, we started out with machine learning, ML, and this goes back to my previous background for performance management, but we're now bringing AI into it. And to kind of simplify for everybody, the way it works, and first of all, it's another elements of healthcare and science. So from that standpoint, we're not, inventing the wheel, but within mental health we are, and it's really taking the data that the practitioners use within an athletic department or a university, and the same data inputs they have from the Psychiatric Association, they're called SOAP notes. They're putting that same data in. We've put together a unique scoring program that has some values both for the practitioner as well as for that ecosystem within sports med. It allows for a communication between this gap that I was talking about, where they can share with the athletic trainers, perhaps with the coaches, a number of a progression, a numerical number, as opposed to what the disorder type is, what the severity level is. So it's a positive. The AI comes from that to understand trends and patterns of how that case is going. So over a period of time, you get to the point with what's an average case outcome from depression, anxiety, eating disorders, what's an excellent case outcome from a timeline standpoint, average, and probably more importantly, where is a negative case trending because of these patterns? And you get a notification to go in and engage and try to make changes in how you're trying to treat that student athlete. So what ultimately happens there is you get into predictives. And if you look at the net of the business world that Dan and colleagues out here live in, it's how do I get the student athlete back into the expected level of competition sooner. If you want to just look at the business element, take the humanistic side of it, it's how do you get them healthy, just like their knee, just like their shoulders, to the point where they can compete at the expected level and the coaches can, win their matches and games. So it starts to predict when those outcomes can happen so people can understand expectations of when they're going to get back into competition.
And we're winding down on our time, and Dan, I wanted to kind of get your final thoughts about looking forward as someone who's been around on multiple campuses, athletics department leader, around not just mental health awareness, but being strategic moving forward as the constructs of college athletics change.
Well, I think our jobs as directors of athletics are, they're multifaceted, but one of the big pieces is to make sure our student athletes have a great experience while they're at your university. And that goes to touching every facet of their day. And I think the mental health piece is growing from a importance perspective, as Walt just talked about. We're going to have people who are injured, but we're going to need to get them back and get them into the best frame of mind that they can. So utilizing the resources we have to make sure that we give our student athletes the best opportunity, whether it's some type of physical healing and training or mental healing and training, that's something that's going to be incumbent on us.
And Walt, any closing thoughts?
Just that I would implore everybody to understand this isn't technology and intelligence. It's not if it's coming, it's when. And I think it's going to happen fast because, as I mentioned, the need and the demand is increasing and not going the other way. So technology is there to help people manage more efficiently. And I would just urge everybody to embrace it.
Walt Norley, Dan Radakovich, thanks for your time. Super important topic.
Thanks, Matt.
Thank you.